Hi, I'm Alana Hippensteel from Pharmacy Times. Today, we're addressing the implications of the federal retail pharmacy program for COVID-19 vaccinations and the role of pharmacy in the implementation of an effective vaccination program in the country. So, joining me for this discussion is Katie Barthelmess, the Cardinal Health COVID-19 Vaccination Network lead at Cardinal Health, Tasha Polster, the vaccine president of pharmacy quality compliance and patient safety at Walgreens, and Denise Scarpelli, the Executive Director of Ambulatory Pharmacy Business and Development at University of Chicago Medicine. So it's clear that pharmacies have an important role in vaccinating the US population. So Tasha, with pharmacies working to vaccinate potentially hundreds of millions of patients, what are some of the aspects of this role for pharmacy in your view?
That's such a great question because, you know, uh, retail pharmacy, community pharmacy, pharmacy in general is absolutely poised across the country to help get our country healthy again. And it's going to take all of us in order to handle the burden of this many patients that need a vaccine. And while vaccine is not new, is this particular vaccine is new, the experience and the model for getting vaccinated at a pharmacy, whether it be retail or other community setting, is not new. So we've vaccinated, about 5 million patients with the COVID-19 vaccine across the long-term care facilities in our stores and throughout our dedicated clinics that we've had in store and off-site. And the experience that we've had in administering off-site we've conducted 150,000 clinics over the course of the years, but most recently more than 60,000 vaccine clinics have been done at long-term care facilities. We have trained pharmacy professionals, pharmacists and technicians, and our technology to fulfill the state and federal reporting requirements around what is required with this particular vaccine. In addition to leveraging the ultra cold freezers and other dry ice storage capabilities, have really helped us to be able to handle not only the vaccine, but taking care of all the patients that need to be vaccinated.
Yeah, absolutely. There's been some challenges in meeting demand for vaccinations while maintaining other services, which for some has required increasing staff, giving staff new roles and responsibilities, and expanding the role of telehealth. So, Denise, what's been the impact of this on both the vaccination process and pharmacy?
So, from a health system standpoint, on the pharmacy side, as we started to plan for the COVID vaccine, we knew we were going to have increased demand from our staff. We weren't getting additional resources to provide this. And for the fact that we have a very large pharmacist staff on the inpatient side, we required our inpatient pharmacists as well as our outpatient pharmacists to dedicate their time to give vaccine. We planned our vaccine clinic. We actually built a clinic specifically for COVID vaccine. We didn't have it go through pharmacy, but it's a combination of our pharmacist, our nursing, and our physician staff that help staff that clinic and that demand. And we knew based on our volume of patients that we were going to have to be able to do 700 to 1,000 vaccines per day, 7 days a week once we got the vaccine. So we staff 16 hours a day, 7 days a week. And it's a big piece of that is staffed by pharmacists. And we knew there was going to be increased demand from them. So we require not only our outpatient pharmacists to do it, but our inpatient pharmacists as well. And you mentioned telehealth visits. When COVID started last March, and our outpatient clinics closed down, we went completely to telehealth. And now probably about 50% of our outpatient visits are all telehealth visits. I know for years we talked about it and wanted to do it, but within like 2 or 3 weeks, we were able to get it up and running and being able to service our patients through telehealth visits. But a lot of our pharmacists work in our clinics as well. So our pharmacists are also seeing patient through telehealth visits and scheduling those. We have a couple clinics that are just managed by pharmacists and they're all done over telehealth.
Right, right. There's also been challenges in the use of scheduling systems for vaccinations, which has required either utilizing systems already in place or, in some cases, implementing a new system. Also, there's been a need for pharmacies to support additional functions in order to provide patients with reminders, necessary paperwork, and other assistance for the vaccination process. So for you, Katie, what are your thoughts on these challenges and how to best manage them?
Yeah, so that's the great question, Alana. So when we were approached by the CDC back in November to become a network administrator for this federal retail pharmacy program, that was a conversation we had to start with our pharmacy customers back then. Some pharmacies had scheduling systems and reporting systems in place, and other pharmacies didn't have some of those capabilities set up already. So really leading up to this rollout, there's been several weeks long conversations and checkpoints with pharmacies to make sure that they're ready to take this on. This is different than the retail pharmacy's typical walk-in flu clinic operation. I mean, it's absolutely critical to have the vaccine appointment scheduled. It helps minimize vaccine waste, especially when supply is so limited. And it also helps ensure that they have the proper information needed to process the billing claim in advance, and that they're prioritizing the patients based on the current patient eligibility in their jurisdiction. So there's a lot of reasons why the scheduling component is so important. And we've really impressed the importance of that on our particular network of pharmacies. And they've been doing a fantastic job meeting the demand there. There's a lot of different commercial scheduling options out there. Cardinal Health, we saw the opportunity to create one that was really tailored to the retail pharmacy setting. It's called My Scheduling. It's really simple, but one of the things that makes it so tailored to this particular effort is it is so integrated with automated reminders for patients. And it's no surprise to anyone that the appointment reminders are just so critical in getting patients to come to their appointments, and then also very critical in the second dose reminders that in order for a patient to really complete the series properly.
Yeah, absolutely. Some issues have arisen around billing with COVID-19 vaccinations, as well as issues around the ability to bill government agencies for those without insurance. Tasha, what are your thoughts on some of these issues for pharmacy?
I think that this was a big concern across the industry when the COVID vaccine just first launched, to make sure that uninsured patients would not be left with the financial burden of having to pay for the vaccine. The government has done a good job I think, in communicating that there are options for uninsured patients. So we do follow the HRSA guidelines for what to do when patients are without insurance and bill the government on the patient's behalf. And other government funded plans have gotten the COVID vaccine on their formulary, and we have not seen any issues of late of a government funded plan rejecting and not paying for a vaccine. So any uninsured patient can come into the pharmacy to get their vaccine with a zero copay.
Yeah, absolutely. There's been known issues around the availability of vaccine, but there have also been issues around storage and handling of vaccine, adequate supply of PPE, and the use of effective disposal mechanisms for medical waste. Katie, what are your thoughts on some of these issues?
Yeah, so COVID-19 vaccine quantities are still very limited across the nation. And it's no exception that for the federal retail pharmacy program, the COVID vaccine is still limited as well. So we're working really closely with the jurisdictions and the CDC on priority populations as the vaccine effort continues to roll out with this limited supply. And then in relation to the other supplies, PPE, disposal mechanisms, things that are outside of the typical government kits, we've worked really hard to make sure that those supplies are available to the specific pharmacies that we know are activated, just to make sure that no matter what, our pharmacy customers are positioned for success and able to do what they need to do to get shots in arms. We've even increased our focus and support staffing support even around Cardinal Health, the Cardinal Health Vaccination Network. And again, that's just really to help support this federal retail pharmacy program and make sure we're enabling our pharmacies for success.
Right. Issues around vaccine hesitancy have been widely discussed as a potential problem for COVID-19 vaccine uptake in the country. Tasha, what can pharmacists and pharmacies do to address issues around vaccine hesitancy among adults and children? And what is their role in supporting COVID-19 vaccine uptake?
You know, I think one of the things that surprised me with this pandemic is the amount of vaccine hesitancy that happened very early on, or that was occurring very early on. And I think that pharmacists and pharmacy staff being embedded within the communities, their familiar faces, their trusted health resources, they are highly accessible and readily available to the public, and they can build trust around the vaccine and giving patients the relevant and personalized information based on their health history, their situations, their concerns, and helping to share the latest information that are coming, that are becoming available for the public health recommendations, speaking to the family members, getting embedded within the communities. I think, other things that I've seen very recently, especially when you get into areas of medically underserved communities, I think, partnering with civic leaders, advocacy groups, faith-based organizations to offer additional educational programs to try to break down that barrier about vaccine hesitancy and how important the vaccine is, will help us reduce the community spread and get to herd immunity. And I think one of the things that we're really working hard on is really getting into those medically underserved communities to hold vaccine clinics, to help with education to the patients, and be a source of truth, confidence, trust, so that the patients feel comfortable getting the vaccine, so that we can all get back to normalcy or some semblance of normalcy.
Yeah, absolutely. How about the need to promote other vaccines along with the COVID-19 vaccine, and address also the need for catch-up vaccines following the decline in vaccinations during the pandemic? Denise, how can pharmacists address these issues effectively?
Pharmacists are in key positions to really address additional vaccines. I know as we're giving the COVID vaccine, one of the questions is, have you had another vaccine in the last 2 weeks? So one of the things is you can't give other vaccines at the same time, but we're really addressing the fact that you need to get your annual flu shot and any of the other vaccines that you need to get caught up on. Before we went live with COVID vaccine, we were actually testing curbside vaccine at our health system that was actually staffed by pharmacists and nurses. So it was really for back to school vaccines, really driving the importance of flu. And we were promoting this 7 days a week. And we knew people were hesitant to come to their physician to get their vaccine, or maybe come into a pharmacy. So we thought if we did a curbside, that would, alleviate some of the concerns of being maybe exposed to COVID. And they pulled up while the weather was still nice here in Chicago and got their flu and their back to school vaccines. And we feel that as the temperatures start to warm up, we're going to do the same thing with COVID and continue that approach. But we feel that it takes a village, right? And every touch point that anyone touches that patient, if it's pharmacy, is it lab, is it the clinic, is it the inpatient, we are all going to promote the use of vaccines and the vaccines they need, and really see what they're missing to be able to get the vaccines that they needed. Not only COVID, but also flu, Tdap, and all the other vaccines that are required.
Yeah, absolutely. And Katie, are there additional considerations for pharmacies interested in administering COVID-19 vaccines through the federal retail pharmacy program or through a future rollout?
So great question. So, and some exciting news, before this federal retail pharmacy program rollout, there was sort of a line snapped in terms of pharmacies that had enrolled were getting ready, and we had to activate the network right before we could really consider adding new pharmacies. The CDC has now allowed us to open up enrollment to the networks again. So if a pharmacy finds themselves ready to participate, wanting to enroll in the COVID-19 response and help out, they can do so, which is, I think, very exciting. And I would say in terms of considerations or things a pharmacy would need to do to prepare, I'm sure Denise and Tasha feel the same way with their provider locations. That's what we as network administrators are here to do and help support, is if a pharmacy is interested in becoming a COVID-19 vaccinator, we're here to help them check all those boxes on reporting and scheduling and clinical recommendations, and just helping them know the full scope of what they would need to get ready. So if they feel ready and willing to participate, I would encourage pharmacies to do so.
Yeah, that is excellent news. Fantastic.
Yeah.
So currently, clinical studies have begun investigating the efficacy of potential booster shots to manage the emergence of SARS-CoV-2 variants. Denise, how might the need for these booster shots affect outlooks on vaccinations?
So I think it's still early to say. So they are researching, does the current COVID vaccine address the variants that are being seen? And I know there's research being done even at my own organization. From a booster shot, I think there's still studies being done that they don't know how long is the vaccine, how long do you have immunity? If you had COVID, how long do you have immunity right now? It's 90 days, but there is a feel that there's probably going to be a need for a booster shot, similar to getting your annual flu shot every year. I know as we're discussing it and planning it, we just feel that it's going to be incorporated when we do flu shots and figure out how we do that. I think the concern right now is getting everyone vaccinated quickly, so as the fall approaches and flu season approaches again, that we're ready to be able to, if we have to do boosters, that we are able to provide that, so that enough Americans have been able to get their vaccine so they can even be qualified to get a booster. But I think it's still early to say. We're learning stuff every day around the vaccine and around COVID and all these new variants that are out there. We feel that it will cover it, but it's still too soon to say. But there is a feeling that we will need a booster probably annually for COVID.
Right. So looking to the future of pharmacy beyond COVID-19, how might these successes realized with the provision of additional services through COVID-19 further enhance the role of pharmacy in the healthcare continuum? To start, Tasha, and then I want to get each of your perspectives on this issue.
Sure, yeah, happy to start. I think that when we had the first pandemic with H1N1, we truly put the value of pharmacists to be able to do more than just put pills in the bottle and counsel patients. We put the immunizing piece into that pandemic, and we showed the value of what community pharmacy can bring to the population. And I think, if you think about, 80 more than or almost 80% of the population is within 5 miles of a Walgreens store or a community pharmacy. The access of the pharmacy to be able to help patients is very easy for those patients to get the assistance that they need. And what we're seeing in this pandemic is the expanded role of the pharmacist and the pharmacy technicians, because HHS has recognized the critical role that these pharmacies can play in supporting the health and well-being of communities across the nation. And just expanding the scope of administering vaccines from a technician perspective, as well as COVID testing. We continue to work with HHS and the state and local authorities to continue to expand the pharmacy technician authority to support beyond the COVID vaccine to, flu and non-flu vaccines as well. But I think that the pandemics, one thing that they do is they show the value that other healthcare professionals can bring. And I really feel that the expanded scope is one of the biggest successes that we're going to see across our country.
Yeah, yeah. And Katie, what are your thoughts on this?
Yeah, I agree wholeheartedly with Tasha. I mean, at Cardinal Health, we are really excited that our federal government put its faith in pharmacies across the US to take on this incredible opportunity and tremendous task of vaccinating our nation. And truly, pharmacists have been engaged in helping patients navigate this pandemic beyond the vaccine. So as Tasha mentioned, offering COVID testing, increasing their medication delivery capabilities, many engaging in telehealth capabilities that they'd never engaged in before, and just continuing to remain open and available as a trusted partner in healthcare, utilizing social distancing and other guidelines to keep everyone safe. So I think this really reinforces the importance of pharmacists as a critical member of the healthcare team. And we have high hopes that this paves the way for expanded pharmacist scope of practice and expanded provider status as the states at the state level really see what pharmacists bring to the table. So it's an exciting time to see the pharmacists expanding their role as a provider for their patients.
Yeah, absolutely. And Denise, what are your thoughts on this?
Yeah, I have to agree with both Tasha and Katie, but as you think about as COVID began, and HHS, had some orders come in. A lot of state governors made executive orders where pharmacists can do COVID testing and expanded scope of vaccinations, and then included pharmacy technicians. And I think some of those executive orders will stand and become law in many states. But I think because the accessibility of your community pharmacist, that you can walk off the street and go walk in and get a flu shot. I think we demonstrated with the release of us doing flu vaccine. And when you think about getting a flu shot, everybody thinks about going to their local pharmacy. So we have demonstrated this time and time again that pharmacy can step up and take on these large initiatives. That I think we are demonstrating what we can do with COVID vaccine. And I just think about some of the things like Walgreens is doing and going in long-term care facilities. I mean, they're the ones going and vaccinating these individuals. It's not physicians, it's not nurses, it's pharmacists. And time again, pharmacists step up to show their value. And I hope that this demonstrates the value of the pharmacist so that we can take on more clinical services and demonstrate what we can do to be an integral part of the community. And actually, when I think about some of the communities that are underserved, the one piece that is always there is a pharmacy. So, in most of these underserved communities, the most trusted healthcare profession is their pharmacist. And I think it's their pharmacist speaking up and saying, you need to get the vaccine, that they will step up and get it and go there. So it's really having that accessibility, being able to make that impact in the community and really getting people vaccinated very quickly by using our pharmacists and pharmacy technicians across the nation.
Yeah, absolutely. Thank you all so much for taking the time to speak with me today.